Good morning, ma'am. I'm Irish Carnazo, and for today I'm going to perform an hot and cold compress. And I'm from BSN Y13P92. First, identify the client. Good morning, ma'am. I'm Irish Carnazo, and I will be a nurse for today. When I see your wristband, ma'am, could you please state your name and date of birth? Mr. Malas and number 20. If the patient is unconscious, you can check the medical record if and the relative of the patient. And the other method is to ask the coworkers to identify the patient. Next is verify the doctor's order for the type of the MORS code application and the location of it, duration, and the desired temperature. After that, of course, review the client's chart for the medical history and the contraindication that may prohibited the hot or warm therapy. After that, assess the client's skin, assess in the area to be treated, and client's temperature and skin or pain stability. Yeah. And after assessing the skin of the patient, inspect the wound if there's if the size, the odor, the color, the tenderness, and the drainage. After assessing it, after inspecting it, assess the client and the family's awareness about the procedures, and assume that I have the relative here. I'm gonna ask the relative if aware sila sa ginagawang procedure sa patient. And after asking the families, ask the patient if he or she is aware about the procedures ongoing. Okay, ma'am, aware po ba kayo na-inform po ba kayo sa pag-hot or cold compress ng inyong wound? Okay. After that, assess the client's vital signs and mobility. Okay. Assume that I already checked the vital signs and mobility of the patient. After that, identify the expected outcomes. Of course, in these procedures, the cold compress is used for the pagtanggal po ng swelling and inflammation from the wound of the patient. After that, I'm going to prepare all the equipment, and we have here the cover in the patient, and assume that since we don't have cold compress here, we provide a towel and a cup in here to put the ice, and an alcohol and ice, and cover for the patient. After that, after preparing all the equipment, you have to describe the sensation to the patient. Ma'am, sa pagbibigay ko po ng cold compress inyo, makakaramdam po kayo ng kilite, of course, and coldness, but or numbness, and it is normal po kasi malamig po yung mabibigay po pong compress sa inyo. And after that, of course, you have to provide a privacy. You have to provide the privacy for the client to ensure the privacy of the client. After that, position the client keep only the area na ipo-fold compress. So in these procedures, only the hand of the patient is going to expose, and after that, I'm going to perform a hand hygiene to prevent any microorganism. And after that, I'm going to place the waterproof pad or the towel to the client's body part. Okay. After that, we're going to put an ice. But before that, I'm going to put gloves. After putting gloves, going to have the cold compress and put some ice. After that, let the ice cool to the towel. Wait for a few minutes. After that, apply the cold compress to the affected area and mold it over the site. After that, remove the lemon stem to the towel and reapply to maintain the cold temperature. After performing an cold compress to the patient, check the skin condition at appropriate and regular intervals. Stop application immediately if any untoward or incident happen or problem occur to prevent any ma-prevent yung paglalang sakit sa wound po ng patient. After that, remove gloves and have the patient sit in or have comfortable position. After that, clear or dry the skin store or dispose all the dispose mo lahat ng mga ginamit na materials, of course, para hindi po makahawa sa ibang patient if of course if it's contaminated. After all the assessment, inspect the wound of the patient if there's any if there's any improvement and effectiveness of to the therapy and sensitivity to the touch. Masarap po ba? Okay. Upon inspecting after a few hours of using cold compress, the cold compress therapy is actually effective. The swelling and the swelling is reduced and it goes. After that, ask the client paano po yung nararamdaman niya sa katawan niya after a few minutes of giving a cold compress. Okay, ma'am, ano po yung nararamdaman niya? Wala po ba kayong nararamdaman na burning sensation? Okay. After that, identify any unwanted outcome. If there's any, you can proceed to the next procedure. After that, you have to document all the procedures that you did. After that, you have to give it to the physicians and inform the patient that you inform or you give the document to the physician. Now, all the procedures and the outcomes will be noted and documented and give it to your physician. And that's all for our cold compress. Let's proceed to the hot compress. And now I will position the patient into a comfortable and I will give and only expose the body part that will be going to hot compress. And now I'm going to perform hot hygiene and put the gloves. After that, I'm going to place a towel below the arm of the patient. And I'm going to apply the heat compress. Since we don't have a hot compress here, we have a bottle and it is hot, and I'm going to cover it with the towel. After that, I'm going to apply it to the head of the patient. Stop immediately applying if there's any untoward incident or problem occur. After that, inspect the hand of the patient after a few minutes of giving a hot compress. And it how's the good condition for evidence of the effectiveness of the therapy and sensitive touch. After that, ask the client how's the sensation of her wounds. Ma'am, kumusta naman po yung nasa-feel mo po ngayon sa okay lang? After that, obtain a vital signs and compare with the baseline. After that, since we don't have any unexpected outcome, after that, I'm going to remove my gloves and hand hygiene and document all the findings. And after that, place the patient into a comfortable position. After that, after documenting, assure the patient that all the documents, all the findings are completely confidential between the physician, me, and her to ensure her security or privacy. Okay, ma'am, all the documents I noted are completely confidential between me, you, and the physician attending to you now. Okay. That's all for our hot compress. Thank you.